Fertility treatment is literally life-changing medicine that has helped countless people reach their dreams of family in ways that simply weren't possible just a few decades ago. But, like many things in medicine, it does come with its risks and side effects. So in this video, we're going to hear from an expert about some of the risks associated with the various treatment options.
Hi, my name is Anish Shah. I'm one of the physicians and practice director at Shady Grove, Richmond.
Before we dive in, I just ask that you like and subscribe. And if you want to talk to your employer about bringing fertility coverage to your workplace, we have resources for you at progeny.com/talk-to-HR. Let's start with some of the less invasive treatment options, the stuff they call low-tech. Things like ovulation induction and intrauterine insemination.
Low-tech treatments with fertility are pretty well tolerated. Most of the time it involves medications in the form of pills and insemination. Both of these things are been around for many, many decades and well understood. Clomid tends to have some side effects associated in some patients, but rarely. Hot flashes, night sweats. I always tell my patients to take it before they go to bed, and usually they'll sleep through it and turn on the AC. I would say that the majority of my patients never even complain of anything. Letrozole or Femara is the other medication that we use often with low-tech treatments, and its main side effect is headache and sometimes blurred vision. Again, you know, if you take it before bedtime, it's often a way to kind of avoid those things. Like most fertility treatments, it involves some increase in your hormones, and so therefore you will feel a little bloated through that process, not unlike when you're first pregnant.
And then there's IVF. IVF is, as you might know, a more advanced treatment. But as you'll hear, it's not an extremely high-risk proposition.
IVF is, in many ways, a more natural process in the sense that you're using your natural hormones for roughly about 2 weeks. The side effects are usually associated with the injection site that you have to inject the medication. But otherwise, it's well tolerated. It's most often described as having how you feel when you're first pregnant. So you'll feel bloated. Often it's increase in water weight. All of this will be reversible once you go through your period.
So as unnatural as IVF might feel, it's often performed in a way that's simply enhancing the natural processes of the body. But a part of IVF that is a bit more invasive than the rest is the egg retrieval.
Whenever we're extracting eggs, it's not as complicated as normal surgery, but we do have risk for bleeding, infection, even damage to other adjacent organs. But in the hands of a trained professional like all of us that are board certified in reproductive endocrinology and fertility, it's 1 in 3,000.
There is another risk that doctors are always on the lookout for: OHSS.
There's no real risk with embryo transfer, but in IVF in general, we always worry about something called ovarian hyperstimulation syndrome. And I'll tell you that that risk is probably less than 1% with contemporary treatment these days. So, you know, with the advent of the last decade of all modernization of what we do, we've been able to create strategies to avoid this risk.
Now, the biggest risk associated with IVF is actually one that many people wouldn't think of as a risk. And that is the risks associated with multiples, so twins or triplets.
When our body was intended to have one baby at a time, and whenever we deliberately end up with more than one child or more than one pregnancy, those pregnancies are at risk for delivering too early and then have secondary complications. In general, most modern fertility practices will avoid this risk by putting one embryo back at a time, so that if you look at most clinics, their twin rate should be well below 5%, because really if we put one embryo back at a time, then you'll only have one baby at a time.
We've talked about risks, but now let's talk about myths. Like many things, when you search online, you might find a lot of information that just isn't accurate.
Yeah, so I think people assume that fertility treatment might cause risk for breast cancer. There was a large study published in the Journal of American Medical Association out of Europe that showed that with 20-year follow-up, people that were exposed to IVF in the Dutch population and then 20 years later showed no increased risk for breast cancer. I think that's often something that people worry about. If you think about it, if you're taking something and it increases or changes your body for about a week and increases your hormones, it's not like something that you take day after day for years. So hormone replacement, on the other hand, has had associations over long-term usage with breast cancer, but not with fertility treatment.
Risks of fertility treatment isn't exactly the sexiest topic for a video, but it's an important one. This is your body and your health, and it's important that you know what you're getting into whenever you interact with healthcare on any level. And it's extremely important to remember that this kind of information is always best when it comes from an actual doctor, a true expert like Dr. Anish Shah from Shady Grove Fertility. Thank you for taking the time to watch this video. If you like hearing from the world's best doctors, please leave a like and subscribe to the channel. And if you want to learn more about Progeny, visit progeny.com/education. Finally, if you want to learn how you can help bring fertility benefits to your workplace, check out our resources at progeny.com/talktohr.